Reducing Pressure Injuries by Lisa Gagan. As an RN in a skilled nursing and rehab facility, one of my main goals is to prevent pressure injuries. It is a huge focus of my healthcare facility and something we do not take lightly. The failure to prevent a pressure injury is seen as patient harm, a reflection on the quality of care delivered, and will result in a discussion at the highest level about the impacts on the patient's quality of life, the impact on length of stay, and therefore on use of resources. According to the Joint Commission, to accomplish this coordination, high-quality prevention requires an organizational culture and operational practices that promote teamwork and communication, as well as individual expertise. Therefore, improvement in pressure injury prevention calls for a system focus to make needed changes. The Joint Commission has issued an advisory to help healthcare workers prevent pressure injuries related to use of medical devices such as feeding or oxygen delivery tubes, catheters, orthopedic devices, bedpans, and casts. According to the Joint Commission, these types of injuries account for more than 30% of all hospital-acquired pressure injuries. The aim of this project and quality improvement study is to reduce the incidence of pressure injuries by half in 1 year. According to the statistics given to me by the Director of Nursing, 54% of residents leave the facility, whether to other facilities, home, or deceased, with at least one pressure injury. There is not data collected to determine how many of those people developed their injury at the facility or whether we failed to help their previous injury. In order to fix things, we must act. The plan is to monitor and assess the plan and put it into action. Turn and position programs implemented, such as turn and position clock on the wall that determines what side the resident should be leaning on and at what time, toileting schedules for every 2 hours, and also requiring nurses to document and assess for any new pressure injuries on every resident during every shift in order to monitor potential outbreaks, and skin protection in the use of zinc, which is an excellent skin barrier to help prevent injury. These changes will be implemented by a quality assurance RN, designed and assigned by the board, whose only job for the duration of the project would be to oversee and ensure that the procedures are implemented correctly, as well as to assess the data at the end. It is the responsibility of the floor nurse to ensure that proper documentation is turned in to the quality improvement officer appointed. Each month, the documentation will be reviewed by the officer and the unit management team to assess any changes on a month-to-month basis throughout the project. At the end of the year, adjustments can be made to protocols in order to better improve outcomes, which is our main goal as healthcare providers. The use of barrier cream, absorbents, or diapers is recommended among the MH14 and Guideline 15 as humidity management recommendations. These devices should be inspected at each bedside for moisture. To help relieve pressure on the skin for people who are bedbound, turn and position every 2 hours. Cushion heels with soft material. When lying on the side of the bed, place pillows between knees and elbows. Lean back slightly against pillows. Keep the head of the bed at the lowest height possible. Use pressure relieving mattresses or overlays such as sheepskin. These are things we already know. Skin assessment is a key feature in the prevention of pressure injuries occurring. It can be undertaken by any suitably trained to recognize early signs of skin damage, healthcare assistants, relatives, or caregivers who provide personal care and therefore see the skin. They play an important role in identifying changes in the skin. Implementing these changes should be fairly easy. Turn and position every 2 hours, increase and monitor the nutritional needs of the patient or resident, toileting schedule in place, reporting to the quality assurance officer whenever a new reddened area is found as per the printed documentation found on every unit, and needs to hands in at the end of each shift, and apply barrier cream in the form of zinc. A little about me. As I said earlier, my name is Lisa Gagan. I am currently working at a skilled nursing and rehab facility. I just received my RN license back in July, so I'm fairly new to this role. I was an LPN for 2 years, and before that I was an aide in the home care setting. I love working with geriatrics, but I have the dreams of becoming an acute care nurse practitioner and to work in a New York City hospital. Thanks for listening.